Welcome to my site about drug abuse in the state of Kentucky. Drug abuse is a serious issue in the state of Kentucky. The main region and research done on drug abuse focuses on is Eastern Kentucky and areas of the Appalachia where there is more poverty. The main drug on the rise is heroin. Heroin is a very strong opiate that is injected into the body through needles. Heroin is very easily overdosed and can kill the human body immediately or cause a severe infection due to unclean needles drug users inject themselves with. A recent study about viral hepatitis and injection drug use in the Appalachian Kentucky found important information about the overall culture of the area and how it relates to more diseases and drug use. The conclusion from the study states that transmission of hepatitis C in the rural Appalachian communicates is predominantly due to injection drug use. Patients with hepatitis C exposure are similar in their demographic and risk profiles as those seen in urban areas, and despite small numbers, can have a serious impact on a small rural public health systems. This information was found at Kentucky.gov, which has many recent drug abuse reports. But the Appalachia is not the only area in Kentucky. The entire state is on the rise with drug problems and abuse, but the demographic of the Appalachian region holds the highest rates of drug abuse in the state. Research done by the entire state of Kentucky has found health outcomes by county. Health outcomes were calculated using data for premature deaths, birth weight rates, and reports of adults of days for poor and fair physical and mental health as shown using drug abuse. The highest rankings were definitely shown in the Appalachian region and Eastern Kentucky, and then it followed throughout the state. Another study done shows the Appalachian region has the highest overdose and death rates for 2012 to 2015. That is also on the rise from 2015 to 2017. It has almost doubled in percentage for overdose deaths. Drug abuse is not only kept to the eastern region of Kentucky, it is all over the state. The stereotype of the high rate of drug abuse in eastern Kentucky most relates to the higher rates of poverty, but the most known reason for drug abuse is poor lifestyle choices, which includes the entire state, which is one of the reasons why Kentucky is ranked very low on the scale of states with the best overall health. Tobacco is the main drug that is abused in the state of Kentucky. As quoted by the Kentucky Cabinet for Health and Family Services, each year more than 8,000 Kentuckians die of illness caused by tobacco use. Kentucky is known as a tobacco state, and alarming rates of tobacco use is definitely a reflection of that. People get stuck in their ways about what they think is right to them, i.e. their poor lifestyle choices, which leads to a continuation of poor choices from eating unhealthy to smoking, and even trying harder drugs such as heroin. All of these things which are very addictive. People in Kentucky are only hurting themselves, choosing poor lifestyle choices and abusing drugs. Medical bills become astronomically expensive from diseases you can contract from drugs, leading to very high chance of premature death. The death rates relating to drug usage and drug overdose has almost doubled, not only in the state of Kentucky, but the entire country, making it a now leading cause of death in America. Kentucky reports as one of the highest rates of tobacco usage in the entire country. It is shown as the main region is Kentucky males who abuse cigarette smoke, as well as white males, followed by African Americans and Hispanic men. Being informed about drugs and drug abuse is very important. Most people who try drugs, tobacco, or even alcohol to abuse it are not informed or educated about the health risks and what it can do to them in the long run. Many places and websites in and for the state of Kentucky just want to help educate people of drug abuse, not to stop it, but to spread awareness and how to lower the spread of disease and death rates. The state of Kentucky is on the rise for health issues due to the excessive amount of drug abuse. It is important to know about the issue because it is becoming such a large problem, not only in Kentucky, but the entire country. The lack of education is one of the main reasons that people tend to abuse drugs, overdose from them, or contract a disease. The poor lifestyle choice of choosing to use or abuse drugs relates back to the education about them. With the help of stakeholders like the Kentucky Cabinet for Family and Health Services and the Office of Drug Control Policy for the state of Kentucky, people can be educated about drugs, why they are bad, diseases they can lead to, and how most of them are illegal. Tobacco is not illegal, and most people do not consider it a drug, but poor choices are still made with tobacco use, and diseases and death can come from them too. The whole idea is to reduce the drug abuse problem in the state of Kentucky and educate people about the hazardous effects they cause relating to the unhealthiness of the state. Drug abuse can be lowered with more prevention, education, stricter law enforcement, and treatment. Thank you and have a nice day.